So thanks for joining us here at Holland Plastic Surgery. Our topic for our Facebook Live is the Genius, it's radiofrequency microneedling. Sorry we're starting a little bit late, we had a little small technical problem. But we're going to learn about how the treatment's done, what we expect from the treatment, the different kinds of conditions that can be treated, and I will go over all that. What you're seeing here is our patient Annie. She has been treated with a topical numbing medication for the last 35-40 minutes, and now Katie is preparing her skin. This is Katie, our lovely esthetician. This is the best part, is getting the face rubbed down, right? Yeah. And Katie's making sure that her skin is super clean. She's getting all of that local medication off so that the treatment is on very clean skin. Because we're going to penetrate it with needles, and so it's almost like a sterile procedure. We want to keep all the bacteria off and any of that numbing off her skin. So I'm going to show you really quickly what these needles look like before they get started. So you can see the Genius radiofrequency machine. There are 49 little teeny tiny needles. They're actually gold at the tip. You can see how small they are. They come out through the holes in the treatment. Each patient has their own, this is a disposable portion of this treatment, so it's never used on more than one patient. And the exact depth and temperature is dialed in, so when the needles penetrate the skin, they're causing collagen stimulation just by the penetration, and then the little tiny tips are delivering heat into these little areas. And I'll explain more about that later, but this is what the handpiece looks like. And so it's almost little teeny tiny squares that will be treated all over the face and the neck in this case. Radiofrequency microneedling has a couple different indications. The main things are really treating fine lines and wrinkles. It helps tighten the skin, and the other one is scarring. Specifically, the thing that got me most interested in this technology was how well it does with acne scarring. The idea of microneedling has been around quite a long time. Radiofrequency has been around for the last 4 or 5 years. The first generation of this Lutronic machine was called Infini. We've had that for the last 2.5 years. Very similar technology, but they've refined it. The needles are a little bit smaller. The zones of coagulation are more specific, and we can really dial in the temperature to be really careful about exactly what we're delivering depending upon what we're trying to treat. So that's how the technology works. It's all based on collagen stimulation. The mechanical injury to the skin stimulates collagen, and then those little zones of coagulation. So if you can imagine, if you have, your epidermis and your dermis, these needles are penetrating in little teeny tiny areas at 3 different levels of that dermis. So you'll see once Katie starts treating, she'll treat each zone of Annie's face with 3 different layers of treatment. First we do the deeper treatment, then the kind of mid-level, and then the more superficial treatment. The beauty of this treatment is that you get an excellent result with really minimal downtime. Because the barrier function is still intact after the treatment, tomorrow she can wake up, wash her face, do her normal skincare regimen. She can use makeup, she can use sunscreen, she can work out if she wants to work out. So there's really no limitations in activity. So that's the beauty of the treatment, that you get this nice deep treatment but with barrier function intact. So it's not an ablative treatment. The name of the game is collagen stimulation, and she'll start to see improvement in her skin in about 4 to 6 weeks. We usually do this in series, so 3 treatments over a 3-month period of time, and collagen generation just gets better and better. So the maximal improvement that we expect to see is actually 6 months after that 3rd treatment. So all about growing as much collagen as possible, stimulating those cells and getting those collagen bundles to grow, which will tighten her skin and make things smoother and more lifted. We do have a few questions that were written in earlier, and Ashley's been keeping track of the questions. And if you have other questions, you can ask. Ashley's manning the camera, and she can fill us in if there's any questions as we go through this. The first question is about how does the Genius radiofrequency microneedling differ from other regular microneedling? And how this is different is that in an aesthetic microneedling treatment, it's just about the needles penetrating the skin at a very superficial level. How that's beneficial is it really helps with delivering any products, so any treatments that you're using are going to penetrate better with microneedling. This is not meant for penetration. This is really meant for collagen genesis. It's all about the collagen genesis, and so it's how it's a much deeper treatment, and it's delivering that treatment to different levels of that dermis. So you're getting kind of a full treatment rather than at one specific level, and really generating the collagen in a very precise way. Those little areas are little zones of coagulation throughout the whole dermis. The question is how is this treatment performed? I'm gonna grab that gauze behind you. The treatment is performed in the office. We use a topical numbing machine, numbing medicine. You can bless you. A topical numbing medicine. Annie came in 30 to 40 minutes early to get the topical placed. The topical, the longer it stays on, the better it feels. So you can come in up to an hour early to get that topical going. And then we also have the option of a nitrous. We have a machine called Pronox that delivers a nitrous, and that makes things even more comfortable. The treatment takes about 45 minutes. That was another question: how long does it take? It's about a 45-minute for the actual treatment. If you come early for the local, you could be here an hour and a half to 2 hours. As far as when do people expect to see results, that question usually by 4 to 6 weeks after the first treatment, people notice improvement of their skin, that it's there's lessening of the fine lines and wrinkles, that the skin is starting to look tighter and smoother. The results continue to improve for about 6 months. So if you kind of looked at your skin, day to day, you might not notice. Week to week, you're going to notice. And really, kind of the maximal benefit we expect to see at the 6 months after the third treatment. So 3 treatments over a 3-month period of time with maximal improvement at the 6-month mark. The treatments can be repeated, a year later or 2 years later. You could have, a touch-up, maybe just one if you feel like you need a little bit more rejuvenation. The question is, another question, who is a good candidate? We treat, patients in their late teens and early 20s. It's really about what you have and what you want to treat. So for acne scoring, that age is quite variable. For aging skin, face and neck skin, it's really more of like the early 30s is when we start to see people wanting to get that rejuvenation effect. It can be used on other parts of the body if someone has some skin other places that need to be tightened, but it's mostly meant for the face and the neck. And then the question is, can it be combined with other treatments? And it can. Really, almost all the treatments we do here, it's in combination. We're kind of trying to get at all levels of the dermis. Bless you. And to get the maximal effect, you're treating all levels of the skin. So getting on a really good topical regimen. I'm a big proponent of retinols in helping increase skin turnover rate. So topical regimens, and then treatments like this. This is one of the more intense treatments, but we also see one of the greatest benefits from it. Any questions popping up? No. I'm trying to think what else I can tell you about it. Other than that, we're making Annie sneeze.
I don't know why.
Sometimes that happens with
Really?
local, actually. Like you inject local, and then I don't know if it's related to the local.
Maybe I stopped something else.
This is her third pass of her forehead, and that's really, I think the forehead is probably the most intense area. Yeah.
Good to know.
Yeah.
Glad you started.
Yeah, we're trying to get that over with. And you can see, I don't know if you can see on the machine, but there's, now that she's finished the forehead, we move down the face, and based on the area, we can pick how much energy we want to deliver. This allows us to pick the depth of the needles and then the energy of the needles, and allows us to track, what we're delivering in each area of the skin for a pass. Yeah, I'll go grab one. Yeah. Back in 2 seconds.
Next, we're gonna do this area, the nose, and the upper lip.
Okay, I'm ready.
I am.
Okay. Oh gosh.
After the skirt.
I'm gonna start right into here. Alright, here we go.
I'm just gonna put an ice pack on your forehead. You won't be able to stand it for long, but as soon as it bugs you, tell me and I'll move it for you. So basically, interesting technology. The goal is to get rejuvenation, to get collagen genesis, stimulate all those cells as much as possible, to grow as much as possible. And again, it's by delivering heat in little teeny tiny areas of coagulation and the penetration of the needles also.
Size of the nose.
Pardon me?
I'm gonna do the size of the nose.
Okay. Does it feel a little more comfortable than the forehead? Not the nose,
Yes.
but the cheeks, yeah.
Be
Not
careful
that
of
part.
that side that you guys just did.
Oh yeah, she just had a little excision on that left.
Yeah.
Yeah,
This
so you can
side?
skip that.
Okay,
Yeah,
yes,
skip
do
that
that.
side.
Yep.
I'm gonna do this half of your lip, upper lip. Okay.
That helps, right? Every little thing helps.
Counting hooks.
It does.
Alright, I'm gonna move to the side. Okay.
The other neat thing about this machine is it's giving Katie feedback. She knows that each pulse she's delivering with the right amount of pressure because she's getting that positive signal. If ever there isn't enough pressure or there's too much heat in the skin already, it makes a different sound, allowing us to know that heat has already been adequately delivered. So we're not going to over deliver. Okay, I have there's a question here. Is it another 3 treatments when you do a touch-up a year later? Is that the earliest you retreat? Yeah, I would say that's for asking that. So yes, in general, the protocol is 3 treatments in over a 1-year period of time, and then a year later is when we would reassess. So a year from that first treatment, not a year from that first treatment, and that's when we would reassess. And we have had patients who had a series of 3 Infinity, 2 years ago, and now we're starting another series of 3 Genius 2 years later. So it can be repeated. It's all about stimulating that collagen, and that's similar to other things, whether we're using peels or any other types of stimulation, getting on a schedule for that maintenance. It's really about getting the result and then maintaining that result.
This is about taking the focus.
Yeah. Right, yeah, it is. The ice. I was like, it's just another thing to concentrate on.
Alright, ready to go?
Yeah.
Mm-hmm.
So with each pass, the depth of penetration is a little bit lighter, a little bit more superficial. And again, that's the goal of treating from the deep to the mid to the superficial dermis. So we want to get those little teeny tiny areas all treated so we can get the global effect of collagen genesis.
Side of the nose.
You can see the areas on her face that have been treated are a little bit pink, a little bit puffy. It actually feels hot for about 45 minutes to an hour after the procedure. Not painful, but kind of like a sunburn type of hot. And remarkably, when she wakes up in the morning, she'll look, pretty normal. Like no one will be able to see any evidence that kind of that heat will dissipate and that redness will come down. And tomorrow she'll look, just like herself. But that's why it's pink, is from that heat delivery. And that's the response that we're hoping to get. You can focus on balancing that on your
Yes.
Doing very good.
So again, we use the topical numbing medication that goes on about 45 minutes to an hour before the procedure. Pronox, which is an inhaled nitrous that you can it's self-administered if a patient desires just to be a little bit more, a little bit sedated during the procedure. The Pronox really kind of takes the edge off.
Upper lip. Oh, yeah. That was good.
Mm-hmm.
Readjust.
You're already on round 3.
Yeah.
Yeah.
Awesome.
You're doing great.
Halfway. Going fast.
That is, this machine is, it's nice that it delivers it more quickly, which is nice. Feels hot, right? Your forehead feels hot. Yeah.
No, this is cold.
That just, yeah.
But I do want it for distraction.
Yeah.
All right, ready?
Yes. Okay. Here we go.
One more. There's the nose. One more. 1, 2, 3. And look. 4, 1, 2, 3, 4. And the other cheek.
Okay. So this is now, she has had 3 rounds on her forehead, and this is her 3rd round on her mid-face. And after this, we progressed to her lower face and her neck. And I think it's been, I don't know, about 20 minutes since we started, and we're about halfway through the treatment, so it's about right. It usually takes about 45 minutes if it's a face and a neck. If we use nitrous, then someone has to stay for 15 minutes after and recover. It's safe to drive home after. Again, nothing. She won't do anything tonight. She just goes home. Nothing special that she needs to do or anything that she needs to take care of tomorrow. She washes her face like normal and resumes her normal skincare regimen. And then we see her back in a month for the next treatment. And that's it. Thanks for joining us, Annie. Thanks for being such a good
Yes.
patient. And we'll see you next time.